there. Did you have an appointment at our clinic? Oh, wonderful. Well, I'm Cassie. I'll be checking you in today. Okay. So looks like you have an appointment with Dr. Char. Wonderful. Good. Is this your first time in? I thought so. I'm pretty good with faces, and you look like a new face. Okay. So, hon, if you could just confirm your name and date of birth for me. Okay. I do have some forms we need to fill out and kind of go over your reason for visit because it's your first time at our clinic. Is that okay? Good. Are you going to be using any sort of insurance today? Okay. That's fine. Can I get your address? Is that an apartment? Phone number? Is that a cell phone? No, we may text you if you opt in for that, just for appointment reminders for the future, but usually we won't be bombarding you with calls. Yeah. What's a good email for you? Okay. Is that a Gmail or? Perfect. Now what about a primary doctor for you? Okay. And were you referred to us, or how'd you... Oh, cool. Oh, awesome. That's great. Well, you've come to a great place. Dr. Char is amazing, so you should feel very comforted and at ease, yeah, throughout your whole appointment, so don't worry about that. Okay, so just briefly, what brings you in? I'll go a little bit more into detail shortly, but... And that's the right side? Okay, the right side. Okay. Yeah, I know it can be a little nerve-wracking coming to a new clinic, and if you've never been adjusted before, but Dr. Char is very relaxing and takes the time to make sure that you are also relaxed, so don't worry. Okay. Okay. Now, I have a little bit more in-depth medical history, but just offhand, any history of high blood pressure within the last couple months? Okay. Okay. In some cases, it's not a good idea to get adjusted if you're struggling with high blood pressure, so it's good that we know that. And is this are you coming here from an auto injury? Have you ever had a spine injury? Neck injury? Broken any bones? And are you on any medications? Now, have you been to any chiropractor before, not just our clinic? Okay. It's just good if you had, that we know the last time you were adjusted. Yeah, exactly. Okay, so I do have kind of some checkoffs here, so you just need to tell me any of these that apply to you. Okay, so medical conditions. If you have any history of these, you would just let me know and I'll check them off. Arthritis, hypertension, cancer, psychiatric illness, diabetes, skin disorder, heart disease, stroke. Now, have you had any surgeries that would apply? Appendectomy, joint replacement, any sort of brain surgery, carpal tunnel, cardiovascular procedure, prostate, shoulder, gastrointestinal, cervical spine, lumbar spine, alright, hysterectomy, gallbladder, knee, hernia. any of these allergies that you may suffer from: eggs, soy, fish and shellfish, sulfates, milk or lactose, wheat and gluten, peanuts, or anything else? Okay, so just a social history for you. So if you could just tell me occasionally, often, or never for some of these. Okay, so caffeine use: occasionally, often, or never. Alcohol use: occasionally, often, or never. Exercise. Chew tobacco. Cigarettes. Wearing seatbelts. Recreational drug use. So for occupation activity, what would best describe? Administration, heavy equipment operator, food service industry, heavy manual labor, business owner, daycare or childcare, medium manual labor, light manual labor, secretary, construction, manufacturing, executive or legal, computer user, healthcare, home services, housekeeper, or other. Now just a brief family history. If you could tell me if anyone in your immediate family suffers from any of these. Yes, so that would be mother, father, or siblings. Okay. Arthritis, asthma or hay fever, back trouble, cancer, diabetes, disc problems, emphysema, epilepsy, headaches or migraines, high blood pressure, insomnia, kidney trouble, liver trouble, a pinched nerve, scoliosis, sinus trouble, stomach trouble. Yeah, you're doing great, no worries. Just think next time you come in, you don't have to fill all this out again. Okay, so a couple things. If we could just check off if you currently are experiencing these problems or if you have in the past, you would just let me know, okay? Okay. Poor circulation, hypertension, aneurysm, heart disease, heart attack, chest pain, high cholesterol, pacemaker, jaw pain, irregular heartbeat, swelling of the legs. Okay. Cardiovascular area. For respiratory, any asthma, tuberculosis, short breath, emphysema, active cold or flu, a cough or wheezing. Allergic or immune, any hives, immune disorder, HIV, allergy shots, cortisone use. Okay, moving on. For your eyes, any glaucoma, double vision, blurred vision. Okay. Moving on, we have the kidney disease. Okay. Burning urination, frequent urination, blood in the urine, kidney stones, lower side pain. Ear, nose, and throat, difficult swallowing, dizziness, hearing loss, sore throat, nosebleeds, bleeding gums, or sinus problems. Psychiatric, any sort of depression, anxiety, or extended stress. past or present stroke, seizures, head injury, brain aneurysm, numbness, severe headaches, pinched nerves, Parkinson's, carpal tunnel, or vertigo. Past or present thyroid problems, diabetes, hair loss, menopause, or problems with menstruation. Past or present gallbladder problems, bowel problems, liver problems, ulcers, nausea or vomiting, poor appetite. Now, any sort of difficult sleeping, weight loss or gain, low energy. Okay. Past or present hepatitis, blood clots, bruising, excessive bleeding, fever, chills, sweating. Yeah, excess manner, of course. Okay, and then arthritis, joint stiffness, muscle weakness, broken bones, joints. Okay, good. Now, so we're going to kind of check off things here again for daily activities. This could be for your job or just like your daily day-to-day life. Yes, so I'm going to read off some things that you might do throughout your day, and if you can say there's no effect when you do that, there's a mild pain, but you can still do it. There's a moderate pain, like painful but limited, you can still do it, but it's limited, or severe and you're unable to perform. So no effect, mild pain, moderate pain, or severe pain. Okay, so bending, caring for family, carrying groceries, changing position or sitting to standing, climbing stairs, driving, extended computer use, household chores, kneeling, lifting, reading, self-care such as bathing, self-care such as dressing, sleeping, walking, yard work. And is there anything that I didn't mention specifically for you that you would like to have noted in your chart that causes you either mild, moderate, or severe pain? Okay, and what is that? Okay, of course. Good. Yep, add that in. Perfect. Thank you for letting me know. Okay. Okay, so our last little bit here is I have this chart here, and I know you kind of said it was on the right side. But if you could kind of point here to where the painful areas are, I'll just make a note in your chart, and then Dr. Char will have that information going into your adjustment. Okay. Yeah, of course. So you can just kind of point to the different parts of the body and where you might be feeling some discomfort, okay? Okay, so definitely here on the right side. Okay. And here? Okay. You said you do computer work? Yeah. Yeah. No, that's common. Very common. So, okay. Anywhere else you'd like me to make note for Dr. Char? Okay. Good. Easy enough. Add that on in. And then the last bit here is the informed consent form. You give us permission to do your adjustment today. So they could include spinal manipulation, range of motion testing, muscle strength testing, hot and cold therapy, mechanical traction, palpation, posture pump, electric stem, aquamed, vital signs, basic neurological testing, ultrasound, and others. Do you give consent to your adjusting treatment today? Perfect. Do you need these forms sent to you via email? Good. Well, you are all set and you're right on time. We have all your paperwork filled out, so Dr. Char will be with you shortly. Of course, thank you so much for coming in.